Welcome to the Anatomy, Physiology and Pathology with Devon Academy. Before we start the skeletal system, I'd like to just introduce you a little bit to what anatomy, physiology and pathology actually means. The anatomy is what we've got. So in this case, we're going to talk about the skeletal system and the bones and what bones it has. But it might be the muscular system, the endocrine system, the nervous, the urinary. So the anatomy is what we've got. The physiology is how those things work. So we need to know about the physiology of each system, and the pathology are the diseases and disorders of those systems. So in this case, we're going to start with the skeletal system. So we need to know the names of the bones, and it's important if you need to know the names to be able to pronounce them. So I'm going to leave spaces after some of the names of the bones so that you can repeat them after me. We also need to know what the functions of the bones are, the skeletal system. Why do we bother to have them? What would we look like if we didn't have a skeletal system? A little puddle on the floor. And we also need to know about their diseases and disorders of the skeletal system. Now, we're also going to learn a little bit of Latin as we go along, because Latin is very interlinked with medical terms. And if I said to you a little short word beginning with O, you would automatically know that I was talking about the skeletal system or the bones. So if I said osteo to you, you would automatically know that I meant the bones. If I said Arthur to you, you might think it was a joint. So arthritis is inflammation of the joint. So along the way, we're going to do a little bit of Latin, and sometimes understanding where the Latin comes from and what the Latin name is for certain things can help you enormously in working out where you are within the body. So for instance, osteo relates to the skeletal system, but if I said gastro to you, you might know it's the stomach. If I said cardio, you might know that was to do with the heart. So we're going to learn a little bit of Latin as we go along. So let's press on and learn something about the skeletal system. We're going to have a look at the functions of the skeleton, and there are 7 functions to the skeletal system. And the main function, one of the main ones, is it supports the body. If we didn't have a skeleton within our skin, we would be a little puddle on the floor. So it supports the skeletal system and helps us stand upright. Now it also protects the viscera, and viscera is a term for the organs of the body, the soft organs of the body. And viscera, you might refer to a knight in shining armour who used to eviscerate his opponent by cutting open the stomach with a sword. And that was known as eviscerating, because then all the small intestines and stomach and the viscera would actually fall out of the stomach. So that's where that term viscerated came from, or eviscerated. So the skeleton protects the viscera. So the skull is protecting the brain, and the rib cage is protecting the heart and lungs. The pelvic girdle is protecting the kidneys and the gynecological organs. So protecting the viscera is a vital part of what the skeletal system has to do, or the skeleton has to do. Now, the skeleton bones on its own don't move, but the muscles attach to the bones. And without those bone attachments to muscles, then we wouldn't have any movement. So the two systems work very closely together. A more unusual thing that the bones do is it forms blood cells, and within the bone marrow of the blood cells are red, white and clotting blood cells are actually produced. That's unusual, so here I've put it in red so that it's something to highlight maybe in your handout for you to learn for revision. ITEC like more unusual questions. So where you see anything highlighted in red, it's normally something that comes up quite readily in the exam. So we talked about movement, that's a function, but to form muscle attachment is also a function of the bones. Storing calcium, we might understand that we need calcium for good bones and for growth and repair of the bones, but we also need phosphorus. So within the bones, we store excess calcium and phosphorus until we need it. And bones form joints. So where more than one bone joins together, then this is known as a joint. So 7 functions of the skeletal system: support, protection, movement, formation of blood cells, muscle attachment, storage of calcium and phosphorus, and the forming of joints. We're going to have to learn the names of the bones of the body, and we're starting with the skull. The cranium is the name for the top of the skull that protects the brain. There's a pseudonym we have for this, which is FESTPO, so F-E-S-T-P-O, and we're going to need to know how to pronounce these bones as well. So the first one is the frontal bone. The E stands for ethmoid. So the ethmoid bone is the eye socket. So E for ethmoid, E for eye. Ethmoid forms the eye socket. The S stands for sphenoid. Sphenoid gives that circular or spherical shape to the side of the eye and the top of the cheekbone. So it sits just behind the ethmoid, but in front of the temporal at the side of the head. The T stands for the temporal bone, which is just behind the ear and just at the side, just behind the temple, but just above and to the back of the ear. The parietal is either side at the top of the head. And the occipital is at the back of the head. The occipital ridge, if you feel the back of the head where the neck joins the scalp, we have the occipital ridge. So these are the bones of the head. So say them after me. Frontal, ethmoid, sphenoid, temporal, parietal, and occipital. Now we're on the face bones, and we need to know how to say the names and where they are of the face bones. The bottom jaw is the mandible, and this is the only freely movable joint in the whole body. Nothing else on the face moves, certainly not with the variety of movement that does, up and down and side to side. So this is the mandible. The maxilla is the name for the upper jaw. The zygomatic is the name for the cheekbone. The lacrimal is the name for the bottom of the eye socket. Now we also have tear ducts here, and the other name for tear ducts is lacrimal duct. I was born without any proper eyelids, and they had to make tear ducts for me, but because I suffer from dry eyes, it's the only place in my body that I have silicone. So I have silicone implants in my lacrimal ducts to keep the fluid in the eye as long as possible. So lacrimal refers to the bottom of the inside of the eye. The nasal bone is the bone at the top of the nose. So it's not the fleshy bit with the cartilage on it. It's the actual bone at the top of the nose. The vomer is the piece of bone that you can just see there dividing the nose into two nasal cavities, and that's where the cartilage, the septum cartilage, attaches to the vomer. And quite often people like Francis Rossi, because of snorting cocaine, his septum fell out. It eroded away. So the vomer is the name of the bone, and it's the cartilage that's called the septum, and the vomer divides the nose into two nasal cavities. The turbinate on us is very small, and it's the turbinate which gives us the shape of the nose either side of the nose. And Michael Jackson seemed to want to have his nose taken right back to the turbinate bone. So on a dog or a horse, the turbinate is very long and gives them their long snout. But on us, it's a tiny little curve on the side of the nose. The palatal bone is the palate. It's the bone underneath the fleshy palate at the roof of our mouth. The hyoid bone in the top right-hand picture, this arrow points to a tiny little bone at the back of the throat which attaches the tongue to the pharynx at the back of the throat. That's the hyoid bone. So say the names of these bones after me. We have the mandible, maxilla, zygomatic, lacrimal, nasal, vomer, turbinate, palatine, hyoid. That's really good. So practice those pronunciations, and when you're ready, we'll move on. The spinal column is what protects the spinal cord. And the spinal cord is the nerves run through the spinal cord to the whole body, which sends messages to and from the brain. So the spinal column needs to protect with the 33 vertebrae that make up the spinal column, that protects the nerves that run through the spinal cord. So 33 vertebrae, a common question in the exam paper. So we need to know that those 33 vertebrae are divided up into the cervical in the neck, the thoracic, which is the rib cage, the lumbar, the sacral, and the coccyx. There are 7 cervical vertebrae in the neck, 12 thoracic vertebrae also form at the front the ribs or the rib cage, 5 lumbar vertebrae, 5 sacral vertebrae, and 4 coccyx. Now the only 2 of those 33 vertebrae that have a name are the top 2 of the cervical vertebrae. The top one is called the atlas, and the second one is called the axis. And if you imagine the head as being a map of the world or a globe of the world, and that represents your atlas, and the axis is where that globe pivots. So the atlas pivots on the axis, and that's what helps us to turn our head from side to side. This is also known as a pivot joint because of that motion of turning the head from side to side. So the atlas is the first cervical vertebrae, and the axis is the second cervical vertebrae. 12 thoracic ribs make up our rib cage or thoracic vertebrae. And these 12 thoracic vertebrae run from the cervical down to the lumbar. Below the thoracic we have the lumbar area, 5 lumbar vertebrae. Below that we have the 5 sacral or sacrum vertebrae. Again, this is Latin, and in Latin there is always a different tense. There are 6 tenses to pronouncing Latin. I remember hearing the girls when I was at school who learnt Latin chanting a mo, a mass, a mat, a marmus, a mat, or something or other. But there were definitely 6 tenses to every word. So that's why sometimes you'll see sacral written down and sometimes you'll see sacrum. Sometimes you'll see iliac, sometimes you'll see ilium. It's the same word, but it's a different tense. So 5 sacrum bones make up a sort of fused triangular plate at the very lower part of our spine, and then that forms the coccyx. There are 4 bones in the coccyx that form the tailbone. So say after me: cervical, thoracic, lumbar, sacral, and coccyx. They make up 33 vertebrae of your spinal column. So we need to know what make up the rib or thoracic cage, and the clavicle or collarbone is the bone at the top either side of the rib cage. Then the top of the sternum is known as the manubrium. Not a bone that we get many questions about. I don't think we've ever had a question on the manubrium. But that's the top part of the sternum. The sternum is a flat bone that is also known as your breastbone. Then we have 12 thoracic vertebrae. As we said earlier, they come round from the spine, and at the front they form the ribs. We have 12 ribs, and 7 of them are true ribs. If you can see, they come from the back and they come right the way round and attach those top 7 onto the sternum. But the 3 below are known as false ribs. You're not likely to get a question on whether you know how many true, false or floating ribs there are, but it is quite interesting to understand the rib cage. Those 3 false ribs, as you can see, they are attached to each other, but they're not attached to the sternum. And the 2 floating ribs that you can see at the back, they literally do float. They attach onto the thoracic spine at the back, but they float. And these are most likely to be the ones that you might fracture. The singer Cher had these floating ribs removed so that she could increase the gap between her pelvic girdle and her ribs so that she could have a smaller waist. So some stars and models have these ribs removed for cosmetic purposes. So repeat after me. We have the clavicle, manubrium, sternum, thoracic vertebrae or ribs, and they're divided into true, false or floating. We need to know what bones make up the shoulder girdle. Shoulder girdle is the name for the whole shoulder joint, which is made up of the scapula or shoulder blade at the back. That's the triangular bone that we see at the back. The clavicle at the front attaches to the little spiny bit at the top of the scapula. The clavicle is also known as the collarbone, and the humerus bone, which is the bone of the arm. So the scapula, clavicle, humerus make up the shoulder girdle. I always think it's quite funny that the humerus bone doesn't actually make up the funny bone that you feel at your elbow. The funny bone is actually the ulnar bone, which is part of the lower part of the arm. So what we're feeling at the elbow that we sometimes knock is actually the ulnar. So our funny bone is the ulnar and not the humerus. We need to know the names of the bones that make up the pelvic girdle. The pelvic girdle is the proper name for your hips and that whole area that you can see in the picture. The sloping fused bones from the top of the hip right the way down to the pubic bone are known as innominate bones. Innominate means that they're not named, they're not classified. So as a group, they don't really have a name, is what innominate is saying. But individually, they are the ilium. Now, the ilium is that top curved ridge. That part, and about 2 or 3 inches below that, is the ilium. And that curved ridge is known as the iliac crest. And do you remember I said to you that there are 6 different ways to pronounce any one word in Latin? So this is why sometimes this is known as the ilium, and it's also known as the iliac. So the iliac crest is that ridge of the hip bone at the top, and the ilium is the name they give for the about 3 or 4 inches below the iliac crest. All that area is ilium, iliac. Now the ischium is your sit bone. It's the bottom part of this bone, but it's also at the back, and it's a lumpy tuberosity. A tuberosity is a name they give for a lump. So when the bone sticks out like the head of femur, that's known as a tuberosity. And at the back of the pelvic girdle is the ischium, and this is your sit bone. So if you've ever cycled for any length of time, you will know exactly where the ischial tuberosity is, because you will have sat on it and it will be painful. So exactly where you sit, your sit bone, is your ischial tuberosity. That's another Latin variation on ischium. And your pubic bone, or pubis, is the bit at the front. We all know where our pubic bone is. It's the bit at the front. It's covered by a fleshy mons pubis, it's called, M-O-N-S. That protects our pubic bone in women. When we're children, we don't have a mons pubis. We don't have a big fleshy area of skin and fat covering and protecting that bone. But as we go through puberty and as grown women, we will develop, as part of our development through puberty, we will develop a fleshy covering on that pubic bone. So the 3 bones that make up the innominate bones are the ilium, the ischium, and the pubis. But the pelvic girdle is made up of the innominate bones, the sacrum at the back, which is the triangle that we've already talked about, which is part of the vertebral column, the spinal column. The symphysis pubis is the little bit of cartilage that you can see. It's that little space between the pubic bones, or the pubis bones. It's called symphysis pubis, and this cartilage allows a little bit of flexibility and space to occur there in childbirth. So in childbirth, when the baby's head is trying to get through the birth canal, if it's a bit big, the symphysis pubis will allow a little bit of flexibility and a little bit of give there. It'll come apart a little bit to allow the baby's head to go through the birth canal. So that's the symphysis pubis. Then we have the coccyx, which again we can see right in the middle of that sort of birth canal space at the back, underneath the sacrum. That's your coccyx, your tailbone. So the pelvic girdle is made up of the innominate bones, the sacrum, the symphysis pubis, and the coccyx. And the innominate bones are collectively the ilium, the ischium, and the pubis. So repeat after me. Innominate bones, sacrum, symphysis pubis, coccyx, ilium, ischium, and pubis. So what are the arm bones made up of? We probably do know these already, don't we? The humerus is the bone that goes from the shoulder to the elbow. The radius is the bone that goes from the elbow down to the wrist, and that's on the thumb side. So if you remember, the radius is on the thumb side. Now anatomically, we face our hands face forward. So that's the anatomical position. It's to have your hands down by your side with your palms facing forward. So the radius is on the thumb side, that's the radial bone, and the ulna, which is the smallest bone of the two, is on the little finger side. So the little bone is on the little finger side. So repeat after me. Humerus, radius, and ulna. They are the bones of the arm. So what are the arm bones made up of? We probably do know these already, don't we? The humerus is the bone that goes from the shoulder to the elbow. The radius is the bone that goes from the elbow down to the wrist, and that's on the thumb side. So if you remember, the radius is on the thumb side. Now, anatomically, we face our hands face forward. So that's the anatomical position. It's to have your hands down by your side with your palms facing forward. So the radius is on the thumb side, that's the radial bone, and the ulna, which is the smallest bone of the two, is on the little finger side. So the little bone is on the little finger side. So repeat after me. Humerus, radius, and ulna. They are the bones of the arm. We need to know the bones of the hand. Now, it looks scary, but let's just break it down into different chunks. The Latin name of the hand bones is carpals. So we have 8 carpals. So carpal or carpi should immediately indicate to you that we're on the wrist. People who have carpal tunnel syndrome have an inflammation of the wrist. We have 5 metacarpals, and these run from the wrist to the big knuckle at the beginning of the fingers. So they are your metacarpals, and you have 5 of them. Our fingers are known as phalanges, and we have 14 bones that make up the phalanges. So 3 in each finger and 2 on the thumb. Each bone and joint, knuckle, is a hinge joint, except for the thumb, which is known as saddle. It's a saddle joint because it moves, it's not just a hinge, it moves in a lot of different ways. So we have 14 phalanges, 5 metacarpals, and 8 carpals. So I want you to say those with me. 14 phalanges, 5 metacarpals, and 8 carpal bones. C-A-R-P-A-L, carpal. Now we do have to know the individual names of the 8 carpal bones. So if you have a piece of paper, we have 3 carpal bones that begin with T. So 3 T's. And whoever named these bones has not been too imaginative in their names. So at number 5, we can see the first T is the trapezoid. Number 6, we have trapezium. And number 8, we have triquetral. Now, trapezoid and trapezium reminds me of a trapeze circus act. And the triquetral reminds me that when I used to smoke, I was always trying to quit. So triquetral is number 8. We also have 3 bones ending in A-T-E. The first one is lunate. Now, lunate reminds me, lunar is when there's a full moon. The moon is known as lunar. So lunate is a moon-shaped bone. Hamate, which is number 3, reminds me of a hammer. And number 4 is capitate. We have 1 bone that we fracture more readily than any other bone in the wrist, and that's number 7. That's your scaphoid. When you put your hands out to stop yourself from falling, we're more likely to break the scaphoid than any other bone, and it's the one just underneath the thumb. It's the first one that hits the ground when we try and save ourselves if we fall down. So scaphoid. And we might fall down quite a lot because of number 2, which is pisiform. And I'm sure nobody ever has a problem remembering pisiform. So we have 8 carpal bones. Repeat them after me. Lunate, pisiform, hamate, capitate, trapezoid, trapezium, scaphoid, and triquetral. 8 carpals, 5 metacarpals, and 14 phalanges. We might get a question that says, which of the following is not a carpal bone? Which of the following we do not find on the hand? How many metacarpals have we? How many phalanges bones on one hand? How many carpal bones are there? They're the type of questions you can expect about the hand and the wrist. To recap then, the carpal bones, one of the GPs that came on our course shared with us one of the rhymes that they used to learn when they were an intern learning how to become a doctor. And one of the rhymes he had was, "Some lazy therapists pass having copied 20 times." So the first letter of that little rhyme, "Some lazy therapists pass having copied 20 times," might help you remember scaphoid, lunate, trapezoid, pisiform, hamate, capitate, trapezium, and triquetral. So do try and be imaginative and silly and anything really that helps you remember some of these more complicated terms. Moving on to the bones of the leg, the largest bone in the body is the femur, and that's the one that runs from your hip bone down to the knee. The patella is another name for our kneecap. The tibia is the biggest bone from the kneecap down to the ankle. So that's your tibia. And your fibula is the smallest bone. So if you tell a small fib or a little fib, it's the little bone. So it's a fibula. So repeat after me. We have the femur, patella, tibia, and fibula. And the tibia comes down the big toe side, and the fibula comes down the outside to the little toe. The bones of the foot we need to know, and as you can see here, we've got the tibia is the bigger bone coming down the leg or down the shin to the ankle, and that articulates with the talus bone. The fibula, as you can see, is coming down the outside of the foot, and the bottom of the fibula is what makes up the ankle bone. So collectively, the ankle bones are known as tarsals, and there are 7 of them. The metatarsals, again, we've got 5. This forms the middle of the foot, and they run from the ankle bones down to the phalanges again, which are the toes. So we have 5 metatarsals, 7 tarsals, and 14 phalanges. So carpals are in the wrist, tarsals are in the ankle, and there's 1 less tarsal than there is carpal, so there's only 7. And again, they all have names. So the tibia comes down the shin and articulates with one of the main weight-bearing bones of our body, which is the talus. And the heel bone is known as the calcaneus. Now this reminds me of a canine, a dog. And on a dog, the calcaneus is a lot bigger than it is on a human being. So this is your calcaneus bone, which sticks out. That's your heel bone on the left-hand side there. In front of the calcaneus, we've got a bone called the cuboid. Now, Latin, anything that's slightly square-shaped is known as cubed, or cuboid, or cubical, or cuboidal. It all means the same thing. It means it's square, it's cubed. So cuboid. In front of the talus, we have a bone called the navicular. And navicular was a name, anything to do with nautical, to do with boats. And apparently, if you take that bone out even, and have a look at it, it looks like a child's boat. So that's your navicular. And 3 cuneiforms. This reminds me of uniforms. So 3 cuneiforms sit in front of the navicular on the big toe side. So we have 7 tarsals, and they are, repeat after me, talus, calcaneus, cuboid, navicular, and 3 cuneiforms. Then we have tarsals, metatarsals, and phalanges. They're the bones of your foot. So we need to talk about the bone structure. The bones are made up of osteocytes. Now, osteo, we said earlier, was the Latin name for bone, and cyte means cell. So a collection, thousands of osteocytes, makes up different types of bone tissue. And the bone has 2 types of tissue. We have compact bone, and we have cancellous or spongy bone. Now the compact bone is very near the surface. Every bone in the body has a combination of both types of tissue, but the compact tends to be near the surface, and on the outside of bones, maybe the inside the shaft and along the long bones, and running through the middle of the compact bone is a thing called a Haversian canal. It's not necessarily going to be something that you have as part of your question paper, but the Haversian canal is a sort of groove that runs through the middle of the bone where the blood vessels, the lymph vessels, the nerves can be found. Because every cell in the bone and all these tissues are alive, they need to have an oxygen supply to keep them alive. They need to give off carbon dioxide as they use up that oxygen, which is where the blood takes the oxygen to the cells and brings the carbon dioxide away. The lymphatic system is about defense and toxin and waste product removal. And the nerves need to send messages to and from the brain. So we need blood vessels, lymphatic vessels, and nerves for all our bone tissues and cells as well. And they run through the Haversian canal of that compact tissue. So if you think of it as being compact and tightly woven together, these Haversian canals have almost been drilled through to allow space for the blood vessels, the lymph and the nerves, which are really delicate, to be able to travel to all the cells. Now the cancellous and spongy tissue is full of holes. It's a bit like bubble wrap. It gives a lot of strength to the plastic that we wrap things in when we're moving house. And it is those holes that give tensile strength. So the cancellous or spongy tissue is adding strength to the bone. And it's in this type of bone that we find bone marrow. Most of it is found at the ends of long bones, inside irregular, flat and sesamoid bones. But just remember that all bones have 2 types of tissue, and they are compact and cancellous and spongy bone. And the reason I've put it in red is because this is quite a common question is, what makes cancellous bone so strong, and why do we have the holes in it? That's to make it strong. So that's the bone structure and the two types of tissue that you have in your syllabus. We have two types of tissue, and we also have two types of cells. So the mature cells are all known as osteocytes, but they're divided into what they do. We have osteoblasts that form new bone, and we have osteoclasts that break down and reabsorb old bone. As we go through life, we might well chip a little bit of bone off here and crack a little bit of bone there, so that this needs to be broken down and reabsorbed into the body. We also replace our skeleton. The skeleton we start off with when we're babies is not the skeleton we end up with when we are at the end of our life. It's not just down to size, it's also down to needing to replenish and renew those cells. So we take 10 years to grow a new skeleton completely. It's not new in as much as it's not brand new. It's not like a sort of completely new model. It does still have the injuries and the remnants of damage that we've done over the years. Within the bone is bone marrow, and we have, for interest's sake more than anything, we have red and yellow bone marrow. When we're younger, our bone marrow is red, and because it's red, it produces a lot more blood cells. Now, it's in the bone marrow, the red bone marrow, that we produce red and white cells and platelets. So all the blood cells are produced in the red bone marrow. And this is often a question in your exam paper because it's unusual, and they like to ask unusual questions. As we get older and we store more fat in the body, and maybe the production of cells, which has to happen every 20 days, is not as rapid as it might be when you're a child. Our bone marrow turns yellow and it stores fat. Now, in an emergency, one of the interesting things about the body is we have an amazing adaptability. So in an emergency, the bone marrow has the ability to turn red and start really producing a lot of new blood cells. So in an emergency, like if we had a road traffic accident or a severe hemorrhage, and we needed to produce a lot of blood cells all of a sudden because we're life-threatened, the bone marrow will turn red and start producing a lot more blood cells to replenish the ones we've lost. Now, the bone is normally covered in a white layer called periosteum. If you think of being in a submarine and you go up periscope, you send a scope outside of the submarine to have a look around. So peri means outside or around. So periosteum is a white protective layer of the bone. If we were unfortunate enough to fracture a bone and the bone stuck out of the skin, it would be bright white. But sometimes when we get hold of old bits of bone, you might find a bit of bone in the garden belonging to a dog or a cat that's been buried there in the past. That's always a sort of beigey colour. And that's because the periosteum covering of that bone has disintegrated and worn away. So periosteum, again, I've put it in red, is something you do need to highlight in your handouts to make sure that you know, because we do get a lot of questions about periosteum. So it's the white protective covering on the outside of your bones. The bones are defined into 5 shapes. Long bones are a good example of that. It would be the femur, the humerus, the metacarpals of the hand and the ulna in the arm, the phalanges and the radius. An irregular bone might be the vertebrae, the sacrum, the coccyx, the mandible, the maxilla, even the palatine bone is irregular in shape. Short bones, good examples of short bones would be tarsals and carpals, And they're also known as condyloid bones. So they're short condyloid bones. It talks about how they move and glide over one another. A flat bone would be the occipital, the parietal, scapula. The sternum is a flat bone. The innominate bones are flat, smooth bones. The sesamoid bones, there are only two in the body, so this is often a common question. There's the patella, which is the kneecap, and the hyoid. Do you remember where that was? The hyoid is attaching the tongue to the back of the pharynx. And sesamoid means it's curved on one side and flat on the other. So the 5 types of bones with regard to shape are long, irregular, short, flat, sesamoid. And one of the most common questions is to ask about the phalanges, because the long bones are more about their shape, having a sort of bulb at the top and the bottom with a long, narrow shaft in between, and not really about whether they're long or not, because the hinge joints of the phalanges are all long bones, but they're actually not really very long. So that often is a question that you might expect in your test and exam paper. We need to talk about the joints, and the joints in the body are defined by how much movement they have. And there's 3 types of movements. We have fixed and fibrous joints, where there's no movement at all, and a good example of this would be in the skull and the innominate bones. When we're born, our skull bones are not fused together. We don't have our fissures, that's the line you can see on the skull between the bones. They are not fused. In order to give birth and in order for a baby to be born, the skull bones overlap one another, making the head smaller so it can push its way through the birth canal. And then in the first few months of life, we have a little diamond soft patch on the top of the head, which then heals and hardens, and the bones of the skull then form and fuse together. By the time you have a toddler's head is almost full size and will be out of proportion with the rest of its body. So the skull bones and the innominate bones are a good example of a fixed or fibrous joint. A slightly movable joint or cartilaginous joint, a good example of this would be the vertebrae. The vertebrae only move very, very slightly. And in between each vertebrae we have a disc of cartilage which absorbs the shock and protects the vertebrae from damage in the spinal column. The biggest group of joints is going to be freely movable joints, and these are going to be things like the hip, the knee, the ankle, the jaw, the thumb. So this is your freely movable or synovial joint. And all of these joints are surrounded by a synovial capsule. This synovial capsule is full of fluid, synovial fluid, and its job is to lubricate the joints. If we have a synovitis, if you add an itis onto any name, that means it's an inflammation or an infection. So appendicitis is inflammation of the appendix. Synovitis is inflammation of the synovial fluid within one of these freely movable joints. Arthritis is inflammation of the joint, and the term arthur is often referred to as a joint. So if you have an arthroscope or an arthroscopy, that's where they have a look maybe into your knee to see why you've got sort of crepitus or gritty sound when you move your knee. So an arthroscopy is having a look around into a joint. So freely movable or synovial joints are the different types are either a hinge, gliding, ball and socket, saddle, and pivot joint. So we're going to have a look at those 5 types of freely movable joints in the body, which is the biggest group of all. We have 5 types of freely movable or synovial joints, and we need to know about their movements and examples of which they are. So the hinge, this is where the bone moves towards the body or away from it. So just in 2 movements, a hinge joint, and that happens at the elbow, the knee, the ankle, and the phalanges, either the fingers or toes. We have a condyloid or gliding joint. A good example of that would be the tarsals and carpals, and these are sort of like shuffling around, getting themselves comfortable, gliding on one another, and they might move sideways or forwards or back, just shuffling around on each other, gliding. So condyloid or gliding joint of the tarsals and carpals. And the ball and socket joint, we only have 2. We have the hip and we have the shoulder, where the humerus fits into the shoulder girdle and when the femur fits into the pelvic girdle. These are ball and socket joints, and they circumduct, so they rotate within that socket. The saddle joint is unique to the thumb. The thumb moves in all sorts of different directions. It extends, flexes, rotates, circumducts, and it's unique to the thumb. The pivot joints, we have 2. We've already talked about the atlas and the axis in the neck. That gives us a rotation from side to side. But we also have a rotation at the elbow, which allows us, so if you put your hand face up and turn it over, that is a pivot joint, and that's happening between the radius and the ulna. So the elbow is a little bit more complicated. We have the hinge between the humerus and the ulna, which allows us to flex and extend, but we also, between the radius and the ulna, we have this pivot joint, which allows our hand to what we call supinate when it's face up and pronate when it's face down. So that is a pivot joint as well. So the questions might be, which of the following is a pivot joint? Which of the following is a hinge joint? Where would you find a ball and socket joint? Which is the only saddle joint in the body? Growth and repair. As we talked about before, we have these osteocytes called osteoblasts, which are bone forming, osteoclasts, which absorb bone into the body. We also have an area of the bone on the end of the ball and socket and on the ends of bones, which are called an epiphysis. So if you have an epiphany, it's a new idea. An epiphysis is an area where new bone comes from. So it's a separate bone that's developed in infancy and later on joins the main structure after the growth phase has taken place, and that's called an epiphysis. A diaphysis is a term given to the midsection of the bone. This is the bit that holds the bone marrow. And ossification is a term for the laying down of new bone. So if we damage a bone, break a bone, fracture a bone, ossification is the process that knits those 2 bones together using the osteoblasts and the osteoclasts to get rid of the broken bits of bone. So epiphysis is the new bone developed in infancy. Diaphysis is the midsection of the bone containing the bone marrow, and ossification is the laying down of new bone. Epiphysis and diaphysis has never come up in the exam paper yet, so I wouldn't worry too much about those terms, but definitely ossification, osteoblasts and osteoclasts have done. You need to know about the postural deformities that can occur in the body. These normally happen because either we were born with them, they were congenital and hereditary, or they can be environmental. They can be caused by posture and damage as we go through life, or they could be traumatic, which would mean that we might have had an accident, and as a result of that accident, we had a deformity. There are 3 types: there's scoliosis, kyphosis, and lordosis, and you need to know about these different types of deformities. The top right-hand picture is the worst example I could find of a scoliosis. This is an S for scoliosis, an S-shaped curvature of the spine. It's the whole spine. You can have a slight curvature or you could have a really exaggerated curvature like this one. And it's always of the whole length of the spine. So think of all the S's. The S for spine, the S shape, the scoliosis. Kyphosis is Quasimodo. This is where you have a posterior curvature on the thoracic spine. So it's always the thoracic vertebrae. It's an outward or posterior curvature. So if you think of the back of the body being the posterior part of the body and the front of the body being anterior, this is a posterior curvature of the thoracic spine, also may be known as Dowager's hump. But it's always in the thoracic spine and it's always posterior. So that's kyphosis. Now, lordosis is not so easy to see. This chap on the left looks as though he's just got a big belly and a hollow back. But what happens here is the lumbar spine, which is again another L, so the lumbar spine is related to the lordosis. And this is an anterior curvature of the spinal column. So the vertebrae of the spinal column always slightly curve anteriorly, but in this lordosis, either the muscles of the hip or the core muscles are pulling the vertebral column for some reason more anteriorly than it should. So it gives the appearance of having a big belly and a hollow back. That's a lordosis. So lordosis is always of the lumbar spine and it's always anterior. So to recap, say scoliosis. This is the S-shaped curvature of the full length of the spine. Say kyphosis. This is a posterior curvature of always of the thoracic spine, and it's a posterior curvature. And say lordosis. This is a anterior curvature of the lumbar spine. So they are the three postural deformities: scoliosis, kyphosis, lordosis.